Dr. Dan Durrieu here at Family Health Chiropractic, and we are going to talk about the book called The Obesity Code. The author is Jason Fung, and we're going to be hitting why this obesity is such an epidemic in our country. We need to understand intermittent fasting. We need to understand ketogenic diet. We're going to be giving you information to not only make changes with your weight, but changes with your hormones, why your body's reacting the way it is. So there's going to be a ton of information that I'm going to give you. I'm going to fly through this information. So you definitely want to tune in, learn what's going on in your body and how to make those changes. One of the things that we always like to talk about is calories in. Calories in is the food energy that we eat. Calories out is the energy expended for the metabolic function. And we always say when the number of calories we take in exceeds the number of calories we burn, weight gain is the result. We also say eating too much and exercising too little causes weight gain. But is that really the case? Is that actually happening? You know, dietary and lifestyle habits have changed a ton since the 70s, which includes the, lower fat, high carb diets. It includes an increased number of eating opportunities per day. I mean, how many meals are you eating out? Increasing use of high fructose corn syrup, fast food restaurants, all over the Tampa Bay area, and more times in our cars, our vehicles, and of course, are the kids or yourself playing those video games, sitting in front of the computers, on your cell phone. So that increased dietary sugar is also coming into play, and of course, our increase in portion sizes. These are all part of your habits that need to be addressed. And we always want to understand what actually happens when we're taking in those calories into our body. There is a law of thermodynamics, the first law of thermodynamics, which states that energy can neither be created nor destroyed in an isolated system. What that means is if you're eating 200 calories, how is it being used? Is the excess being used for heat or excreted as stools? And so what is the fate of 200 calories that come into our body? The fate is maybe it's heat production, maybe it's protein production, bone production, muscle production, how your brain works, increased heart rate, stroke volume, exercise, physical exertion, detoxification through the liver, through the kidney, digestion, and breathing, and of course, fat production. So these are things that when you're taking those 200 calories into your body, these are the things that your body is doing to utilize those 200 calories. So if your body is taking those 200 calories in and then utilizing those 200 calories correctly, then you're not going to gain weight. Okay? But if you're taking in 200 calories and all your body wants to do is use it for fat production, there is a problem with that basal metabolic activity. The problem of fat accumulation is really a big problem of how that energy is being distributed. The body regulates how energy is being used by hormones. So your hormones are going to actually regulate how those calories are being worked in your body. So important, especially with exercise. Exercise is not the only thing that causes weight loss. Listen to this, it's really important to understand. Total energy expenditure. What does that mean? It means the basal metabolic rate plus the thermogenic effect of food plus non-exercise activity thermogenesis, and then excessive post-exercise oxygen consumption plus exercise. So what that all means is how you are utilizing those calories, what your basal metabolic rate is actually doing inside your body, how that energy is being transferred to breathing, protein production, even fat production. And so what happens is it all being done correctly in your body? Because obesity is usually a state of leptin resistance. Really important to understand that concept as well. Leptin is a primary hormone involved in weight regulation. So leptin resistance happens when the body has insulin resistance. Leptin is a hormone that tells the body to burn fat, which is regulated by insulin. Really, really important. So are you in insulin resistance? And what does that mean? Because if your body is in insulin resistance, you are automatically probably experiencing that leptin resistance, which is the hormone that tells you how to burn fat. So we need to educate you on how to get out of that insulin resistance, out of that leptin resistance, so that when you're eating those 200 calories, it is being produced in your body or taken into your body and utilized correctly. So understand how digestion works then. Because when food is broken down in the stomach and in the small intestine, right? Where also we need to understand when digestion happens, proteins are broken down into amino acids. Fat is broken down into fatty acids. Carbs are broken down into sugars. Fibers are not broken down. They just pass through to help the food go through. So digestion starts in the mouth. Digestion starts in the mouth. When you're actually chewing your food correctly, then that is when digestion will work properly. What does that mean? When we put food in our mouth, before we swallow it, we need to make sure that it's a consistency of applesauce. Very important. Do not swallow your food after just chewing only a couple bites. Chew it first, let that applesauce sit inside your stomach or in your mouth, and then swallow it into the stomach. Very important to do that. That will also help the acid production inside your stomach. Why is that important? Because if you're swallowing food and it's too big, then your body has to produce more acid to break that food down. So if you have acid production where you have GERD or reflux, all you need to really focus on is chewing that food correctly, and you'll see a difference. You'll also see a difference with how you drink. If you're drinking while you're eating, be cautious. We want to drink while we're eating because we're trying to push that food down. But if your food is the consistency of applesauce, you don't have to force that food down. But when you drink and eat at the same time, you're diluting that acid. By diluting that acid, you make the body produce more acid to break that food down. So don't drink while you're eating and chew that food. Very important to understand that part of your digestive system. Proteins. Proteins, they raise insulin, but blood sugars are very minimal that get raised when we eat the protein. Fats, minimal increase in insulin and sugar. So when we eat something that's fatty, we don't have a really big spike in sugar and insulin. And carbs, big spike in sugar, insulin more than other foods. Understand that point. And then let's talk about insulin. Let's talk about what that means. Insulin causes obesity. That's simple. Insulin causes obesity. Cortisol hormones cause obesity. Stress hormone, fight or flight response, steroid hormones produced in the adrenal cortex, prepares the body for action. It also raises insulin, right? And cortisol also increases when you do not get enough. And so one of the biggest factors with cortisol that I teach my patients, especially when they come in for adjustments here at Family Health Chiropractic, one of the things I always teach my patients is we need to make sure you're sleeping correctly. You want to make sure that the right REM cycle of sleep is happening between 10 and 2, because during that time is when you're going to receive that healing. But if you're not sleeping correctly, cortisol levels will spike, go through the roof. So we want to make sure that you're sleeping correctly so those cortisol levels stay at a minimum, okay? So really, really important, because insulin causes obesity. Cortisol hormones will also cause obesity. So we have to understand that. The stress that you're under is also causing your nervous system, the sympathetic part of your nervous system, to be on that fight or flight. It always keeps you going. You're always on the go, go, go. And you're not stimulating that parasympathetic part of the nervous system. That's what calms our body down. That's what calms our mind down. That's what allows us to digest food correctly. So that balance is really important. Watch out for the stress in your life. Also, if you're under a lot of steroids, those will also cause fat increase, right? And then, of course, that insulin production, that increased fight or flight reaction will happen with the adrenals, part of the endocrine system, causing our body to get exhausted with the sympathetic nervous system. So our sympathetic nervous system is overworked. Our parasympathetic nervous system is underworked. That's why a lot of my patients have to get adjusted on a regular basis, because a lot of the misalignments, a lot of the subluxations that they're suffering from are causing interference to their parasympathetic. So we need to remove that nerve interference through soft and gentle adjustments, take that pressure off that part of the nervous system so that that parasympathetic can work correctly, calming down our hormones, helping with digestion, and allowing that balance to happen between the sympathetic and parasympathetic nervous system. Insulin resistance is something that needs to be understood. You need to go back and look at this video over and over and over if you don't get the word insulin resistance. Insulin resistance is when the body has to produce 10 times more the amount of insulin to take that sugar into the cell, which means that you have insulin receptors that grab onto that sugar molecule and take it into the cell. Well, if those insulin receptors are weak, then it takes a lot more receptors to grab the same amount of sugar molecule to bring it into the cell. And so your body's producing more insulin receptors to the point of where it just gets fatigued and tired. It can't produce any more. You go through insulin receptors, resistant, and that insulin receptor is not able to do its job correctly, thus allowing weight gain to happen. So what do we mean? How do we actually decrease insulin resistance? How do we go through that? Period of increased insulin during when we eat is really important to understand. There's a balanced period when we need to decrease that insulin in our body. So one of the biggest things I talk about on how to decrease the amount of insulin resistance happening in our body and how to decrease insulin from being pushed into our body is by eliminating snacking. Eliminating snacking. Really important to understand, because 3 meals and 3 snacks allow us to go into these spikes where our body is totally producing over and over an abundant amount of insulin, which will lead to more insulin resistance. So take out your snacks. Let's start by doing that. Just stop snacking between your meals because it does cause increase in insulin. We need to understand table sugar, called sucrose. What is that? Table sugar, called sucrose, equals 1 glucose, 50% of 1 glucose, plus 1 fructose, 50%. High fructose corn syrup is 55% fructose and 45% glucose. Fructose is a lot more dangerous. It takes a lot more energy to break down fructose corn syrup than it does table sugar. Fructose in processed food is a lot more concentrated than the fructose in fruit. Why? Well, if I take a handful of corn chips that has 50 grams of sugar, and I take watermelon that has 50 grams of sugar, watermelon is going to have, you're going to see a bigger piece of watermelon that equals 50 grams of sugar versus a handful of chips that has 50 grams of sugar. Why? Because the watermelon has a lot of fluid. It's not as concentrated, so it's easier for the body to break down. Whereas when we get these really concentrated carbs, it really is difficult for the body to break down all of that sugar and creates massive amount of insulin resistance right away. So we need to be careful on those processed foods that are really concentrated. We need to be careful of how much we eat of that. Fructose is the most dangerous part of this. Fructose in processed foods definitely is something we need to really think about and look at your diet. If you are eating something that has high fructose corn syrup, stop. Take that out of your diet. Carbohydrates. Carbs are not fattening. Carbs are not fattening. Their toxicity lies in the way they are processed. Refining increases the glycemic index by purifying and concentrating the carbs. So we could have carbs in watermelon, right? Or we can again have carbs in those corn chips. The process of getting that refined carbohydrate, that processed carbohydrate, is going to be really dangerous to our body because it's going to cause a lot of insulin production. It's going to cause a lot of insulin resistance, and eating watermelon is not going to do that as severe. And so that is what's causing that increased level of fat to come into our body, not the carb itself, right? Fiber. There's two types of fiber. We need to understand fiber. There's soluble fiber, which is like beans, oat bran, avocado, berries. And then there's insoluble fibers, which are like vegetables, green leafy vegetables, flaxseed, whole grains, and nuts. Fiber absorbs water to increase volume. Example, like the watermelon, right? Fiber slows down food absorption and decreases food intake because you feel full. That's a good thing, right? Soluble fiber reduces carb absorption, which reduces blood glucose and insulin levels. I'm going to say that again. Soluble fiber, right? Soluble fibers, beans, oat bran, avocados, berries. That type of fiber reduces the carb absorption, which reduces blood glucose and insulin level. So how your body produces that insulin. So we want to sidetrack here just a little bit and talk about vinegar. Because vinegar is not really talked about, but it's a hidden secret that we need to actually bring into this conversation. It's sour wine. That's what vinegar is, right? Antimicrobial properties. Vinegar has antimicrobial properties. Preserve food, right? Long time use. It helps when we put some vinegar in something and we want to preserve it for a while so we can eat something down the road. A lot of good properties. Short-term use, guess what it does? Short-term use, it reduces insulin resistance. 2 teaspoons of vinegar taken with a high-carb meal lowers your blood sugar and insulin level by 34%. So if you know that you're going to have that high-carb meal, take 2 teaspoons of that vinegar. You will decrease how your body produces insulin and lower that blood sugar by 34%. Huge fact, great way to get some of that apple cider vinegar by Bragg. That's a good one to get, and start taking 2 teaspoons when you know you're going to have that high carb meal. Type 2 diabetes, this is really important to understand too, because if you are suffering from, and you're a type 2 diabetic, get on that train of taking 2 tablespoons of apple cider vinegar diluted in water at bedtime. That will help really reduce the fasting morning blood sugars. Really important for those type 2 diabetics. Right before bedtime, swig it with some water. You'll wake up with lower blood sugar levels in the morning. Great tidbit of information. Incretin effect. Stomach produces hormones called incretins that increase insulin secretion. So fats, amino acids, and glucose all stimulate incretin release, thus increasing insulin levels. So it is important to understand that this is another effect of how the insulin is being produced when we're eating. So proteins, we also need to understand. High proteins can cause weight gain, not due to calorie content, but rather the insulin stimulating effect. So even if you're eating a lot of protein, you got to be careful because it does have some effect on increasing that insulin level. Whey is a dairy protein. Whey is a lot in what the protein mixes have is whey. That significantly raises insulin, largely due to the incretin effect. So when you take in that whey, you're causing incretin inside your stomach to actually increase, which is going to cause insulin to increase. So watch how much whey protein you're taking in. If you're trying to lose weight, be careful. Do more of a plant-based protein mix. A fermented vegetable isolate protein mix is much better than the whey. So the whole theory behind the hormonal obesity theory is really needs to be understood. And so when you look at this slide, it will really give you that understanding of the incretin effect with the animal protein, the carbs, the fats, the cortisol level, how all of that just shoves right into producing high insulin amounts, right? And that causes that insulin resistant. And then you're shoving that fructose into the mix. That also causes insulin resistance, which leads in to that obesity. So we have to know what to avoid to decrease that insulin resistance that will not cause obesity. So also, another big part of understanding this whole workshop is understanding fats. Because omega-6 is kind of bad. It's a polyunsaturated fatty acid, and that can be vegetable oil. Causes a lot of inflammation inside of our gut and body. So we really need to be careful if we're cooking with that or if we're using that. Get rid of that vegetable oil. Go more to the avocado oil. So just be cautious. You can use the olive oil, just don't go over a certain high temperature. It's not something I want you to use at a high temperature because it can denature the way that oil, it makes those molecules carcinogenic. So it definitely is not something that should be used at high temps. Olive oil is great for salads. It's great for low heat, not meant for high heat. More of a coconut oil, avocado oil is better for the higher heat. Omega-3 fatty acids, that's actually a good fatty acid because the omega-3 will decrease inflammation. And the examples of omega-3s are like the seeds, the nuts, the walnuts, the oil in fish, coconut oil, real butter, avocado, and extra virgin olive oil. Very important that it's extra virgin olive oil. So what exactly are we looking at to decrease that weight in our body? What do we need to take in? What kind of diet should we be on? And you have all heard of the ketogenic diet. That has a place because it will cause insulin reduction. It will cause that insulin resistant to leave your body. So we want to understand the spices and herbs and pepper and salt that we're using. But low-carb vegetables, excellent. Peppers, onions, tomatoes, green vegetables, all really important in this diet. Avocados, high on the list. We want to make sure that you're having those avocados. Oils need to be coconut oil, avocado oil, extra virgin olive oil. Seeds and nuts, eat them. Chia seeds, pumpkin seeds, flax seeds, walnuts, almonds. Cheese is okay to eat, right? Unprocessed cheese, right? Mozzarella, blue cream cheese, right? We also want to make sure that you are under the understanding of eating goat cheese, and then cheddar is okay as well. Cream and butter, find the grass-fed meat that is from, that's making the cream and butter. So grass-fed beef, that's really important, but you want that for the cream and butter. So just make sure that you're buying grass-fed, right? Fatty fish, great. Mackerel, tuna, trout, salmon, all good go-tos. Meat, turkey, chicken, bacon, sausage, ham, steak, red meat, all are okay to eat in a ketogenic diet. Moderate to low fruit though. Why? Because that increases the sugar intake, which also increases insulin. Low carrots. You want to watch out for sweet potatoes. You want to make sure root vegetables are low as well. So increasing, when you increase consumption of natural fats, that's probably 60% of a ketogenic diet. And these diets like ketogenic, we don't want to use that diet forever and ever and ever. I personally feel that a patient should get on a ketogenic diet for only a short amount of time. And when I say short, 3 to 4 months, and then slightly start transitioning into other ways of eating. And that can be done. We offer a lot of consultations in my office to get people into that post-ketogenic diet after they've gone through keto for a while. You're more than happy to contact our office at Family Health Chiropractic. We have a website, drdanchiropractic.com. Call us, schedule those consults so we can help you understand those post-ketogenic diet procedures and how to do that. But what we need to understand is natural fats are okay. That makes up 60% of that ketogenic diet, and you're less likely to stimulate insulin when you're eating fat, okay? So fat is not gonna make you fat. Fat is actually something that's good, like avocado is high in fat. Extra virgin olive oil, that is high in fat. Butter, coconut oil, nuts and seeds, all have a good amount of fat, but are very good in losing weight. Pure olive oil denotes refined oils. That is bad. We want that extra virgin olive oil. Extra virgin olive oil is good. It's unrefined. And this will help reduce, by the way, heart attacks and strokes. So definitely really get involved with having that extra virgin olive oil because your inflammation levels will go down. Last piece of this puzzle that we want to produce or that we want to understand is reduce consumption of added sugars. Don't put any more sugar in your coffee. Don't put any more sugar on your cereals. Reduce it. Reduce consumption of refined grains, rice, breads. We got to reduce that. Moderate your protein intake. 20 to 30% of your diet should be protein intake. Increase consumption of natural fatty foods. So natural fats, 60% of this diet should be natural fats. Increase your consumption of fiber and vinegar. That will also help reduce that insulin resistance. So the question is, then when do you eat? When do you eat? To break that insulin resistance cycle, we must have recurrent periods of very low insulin levels. That's why we went back and talked about how no snacking is really important because it's not causing those spikes in insulin levels. So how do we introduce to our body this temporary state of very low insulin levels? And one of the biggest things that I talk about, how not to allow our bodies to produce insulin, is through fasting. Fasting, fasting, fasting. So important to understand. This will help your body in jump-starting yourself out of that insulin resistant. The transition from the feed state to fasting state occurs in several different stages. You want to make sure that we are, not increasing that glucose. We want to make sure that you understand where glucose is being stored, right? We have glucose in our body, but did you know you also have glucose in your liver as well? So we have to eliminate sugars in our liver, and we have to eliminate sugars in our body first to get out of the insulin resistant before we introduce intermittent fasting. So the first step is really important. The first step is to go 24 to 36 hours of fasting first. So what that means is 6 to 24 hours after fasting starts, we're already eliminating sugars in our body. And this is important to understand because we have to get rid of all the sugar in the body and the liver. So after doing this for 24 to 36 hours, we will see that our bodies will have eliminated the sugar, and that means that our body is not producing that insulin, and we're not going to have as much resistance. We're going to be able to build our body back up. Now, why is that? Because you're resting your body. You're resting your body from producing insulin. Back in the day when there were hunters and gatherers, they would go out, they would kill their deer or hog or whatever they're killing, bring it back, feast, and then they wouldn't just go back out and kill another deer. They would rest for 2-3 days, fast, and then go back out and hunt and gather. We are so ingrained to have 3, 4, 5 meals a day, snack, 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 that we're bombarding ourselves with so much food that our bodies are having a hard time keeping up with what we're doing. It's really okay to create a level of fast. Start off, give yourself those 24 to 36 hours of fast, and then go into some intermittent fasting. So we just need to really get some basics out of this slide for you to understand glycogenesis, ketosis. What we really need to just understand here is the idea is to fast first, get rid of the sugar in our body, get rid of the sugar in our liver. Then once we do that, we'll go into a state of ketosis, right? And that's when we need to start eating again. So we want to bring our bodies into that level of understanding ketosis and then start eating again and slowly picking the right foods, okay? Very, very important. Protein conservation phase. This is high levels of growth hormone produced to maintain muscle mass. Increased levels of norepinephrine prevent decrease of metabolic rate. So what that helps you understand is, after your 5th day of doing this, your body is going to start producing the hormones correctly. Your body is going to start creating the right type of basal metabolic activity. What that means is that when you're past 5 days, right, you will take in those 200 calories. You will take in that food, and what's going to happen is your body is going to utilize those calories correctly because you're going to be out of insulin resistance. It's going to be breaking down during digestion and breathing and heat production. you're not going to use those 200 calories and go right into fat production. So this happens after 5 days of going through the fasting and leading into intermittent fasting. When you get to that ketosis, what are the benefits of getting into that level of ketosis, right? The benefit of ketones, it's really, really simple. They produce far fewer free radicals than the metabolism of glucose, right? High fructose corn syrup causes an enormous amount of free radicals. When you get into ketosis from fasting and you're at that level, you're not producing high amount of sugar in your body. You're not gaining that sugar in your body. You're not causing insulin resistance, and that's affecting free radical formation, which leads to cancer, right? Ketones stimulate the cells to produce more healthier mitochondria, which is the powerhouse of the cell. And this helps with Alzheimer's, Parkinson's, ALS, heart failure, aging. So important to get our bodies to that level, staying away from what produces insulin, like the high fructose corn syrup. So to understand ketones and understand what they do and the benefits, fasting helps with this ketogenic diet, right? So use pH strips to monitor when you're going into that ketosis. You can pick that up at any health food store, and it's just touching the tongue, going into the saliva. Get an idea of when you're going into that ketosis by these pH strips. That will definitely allow you to know when you're ready to get out of that fasting and start eating. Ketones, remember, drastically reduce inflammation. So we want to get to this state because this will help against disease. It will help against cancer. Ketones increase the number of mitochondria within your brain cells. Ketones cause increase in growth hormone. They increase blood flow in the heart by 75%. Ketones also will lower your blood pressure by lowering those insulin levels. So really, really important to get to that level. Monitor it by getting those pH strips found at a health food store. So go through your fasting, monitor your levels when you get down to a lower pH, right? And you're in that ketosis, that's when you stop your fasting. So a lot of myths are out there about fasting. Fasting will make you lose muscle. Brain needs glucose to function. Fasting puts you in a starvation mode, lowering your basal metabolic activity. Fasting will overwhelm you with hunger. Fasting causes overeating when you resume eating. Fasting deserves or causes your body to lose or to be deprived of nutrients. Fasting causes hypoglycemia. So these are all things out there that are not actually accurate about fasting. We need to understand how all of that works. And so once we get you past 24 hours and up to 36 hours of fasting, then we want to transition into intermittent fasting, which allows us to maintain those insulin levels, maintain how your body produces insulin so we don't get to insulin resistance. And so there's different types of intermittent fasting. One way that I like to do intermittent fasting is what's called the 16-8 program, which means 8 hours you're eating, 16 hours you're fasting. 8 hours is when you're eating, 16 hours. So a lot of times I find myself not eating until maybe 11 o'clock, right? And I'm not really snacking, but I might have a couple meals in that 8 hour period. Then I stop, I can drink water. You can have even coffee because that's not going to increase insulin levels, but don't eat. Don't eat. That is called intermittent fasting. It allows your body to get the nutrients in, but you're not bombarding it, causing insulin resistance. So important. So we're going to give you a 3-day meal plan with 24-hour fasting protocol. And then we're going to kind of outline, that Monday, Tuesday, Wednesday. This allows you to understand how to eat your breakfast, lunch, and dinner, even desserts, gives you an idea of what to do. So this is a sample 3-day meal plan that will help you. Remember, start slow. With intermittent fasting and ketogenic diet, start slow. Get your body used to this. Do not do intermittent fasting first. You want to make sure that you go through the 24, 36-hour fast first and then go in to the intermittent fasting. Do the ketogenic diet first. Then after 2 weeks go by, start the intermittent fasting too. So let me back up by saying fasting, then we want to start the ketogenic diet, right? And then once we get that under control, then introduce the intermittent fasting, the 16-8 program, right? Intermittent fasting works best if done slowly, right? You realize, okay, it's lunchtime and you are not hungry, skip it, eat a dinner, okay? If it's too late to eat, skip it, eat breakfast. So use it and do it very slow. There's not a right or wrong way to go through this, but again, just to repeat, you want to make sure you do your fasting, start your ketogenic diet, and then introduce the intermittent fasting as you're doing the diet. Now, a lot of this information, I want you to go back and just look at these slides. These slides will give you that information that you need. If you want to go into this a little bit more in detail and really understand even more than what I'm giving you on this brief explanation, go look at Jason Fung's work. Dr. Jason Fung, he has the book, The Obesity Code. Great book. You can get the Cliff Notes, read more about it. But my purpose with this workshop is to get you started, give you a little bit of information, to give you a teaser to start your journey through understanding insulin resistance and how insulin resistance is one of the biggest causes of weight gain, how that can be changed, how type 2 diabetes can be changed, and how you can also utilize chiropractic adjustments to help with your basal metabolic activity and get you out of that sympathetic mode, bring in the parasympathetic mode, bring in the right digestion. So, welcome to your journey. I hope it goes well. Get your adjustments, start your ketogenic diet. And if you have any questions in regard to any of this information, please call us at 813-882-8181 or visit our website at drdanchiropractic.com.